Picture this. It is just an ordinary evening.
Right.
You come in from a walk with your dog. And for today's deep dive, we are looking specifically at the Bull Terrier.
Such a fascinating breed to study for this.
Yeah, they really are.
Yeah.
So you go through the usual post-walk routine,
Mm.
wipe the paws, check between the toes, and you find a tiny red spot that, definitely was not there yesterday.
Just a small change.
Exactly.
Yeah.
Then you run a hand along her side, and you realize her ribs are just a little harder to feel than they were, say, 2 months ago.
Yep.
You lift one ear to peek inside. She tips her head but stays put because, well, you've been doing this since she was a puppy. You lift her lip, notice a bit more tartar on that back tooth.
And then what happened?
And then she just hops up, grabs a squeaky toy, and trots off into the living room looking completely 100% healthy.
I mean, it is the picture of a perfectly fine, happy dog. And yet, if you dive into the veterinary guides and breed-specific care material we are unpacking today, that 5-minute interaction is secretly a masterclass in preventive health care.
Okay, let's unpack this. Why is this entirely ordinary, incredibly mundane evening routine actually the gold standard of care?
Well,
Because, honestly, nobody's job here is to diagnose a complex dermatological condition from a 5-minute paw wipe. We aren't playing vet in our living rooms,
right. If we connect this to the bigger picture, true preventive care is sustainable and systematic.
Right.
It is not a one-time checklist that you print off the internet, stick on your fridge, and promptly forget about until something goes horribly wrong.
Yeah, that happens way too often.
It really does. The goal of that evening routine isn't to diagnose a disease. The goal is simply knowing what normal looks like for your specific dog.
Because you can't spot the abnormal without it.
Exactly. You cannot possibly recognize a medical anomaly if you haven't firmly established the baseline.
Right. To build a health system, you first need that baseline. And with dogs generally, but especially with a breed as physically robust and stoic as the Bull Terrier, their outward physical appearance is incredibly deceptive.
Oh, absolutely.
I mean, they are absolute masters of disguise.
They really are. And building that baseline starts with the most underrated, almost invisible first step.
Which is what?
Daily, active observation. It requires shifting your mindset from just being in the same room as your dog to actually watching their mechanics.
Like how they move around the house.
Yes. Is she eating and drinking with the same rhythm today? When she rises from her bed after a long nap, is there a slight hesitation in her hind legs? Is her stride completely even as she walks across the slippery kitchen floor?
It sounds basic, but it matters hugely because, well, we fall into the trap of the exterior.
We do.
The materials we're examining today highlight how the short coat of a Bull Terrier, especially the white ones, is a massive optical illusion.
It's a huge trap.
Right. You look at a short-coated dog and think, well, I can see every muscle. There's no fluffy fur hiding a tumor or a wound.
But that surface-level view completely hides subtle systemic changes.
Yeah, it hides gradual weight gain, it hides muscle atrophy along the spine, and it hides hidden tenderness in the abdomen. Relying just on looking at a short-coated dog is like trusting a used car just because the paint job is shiny.
That's a perfect way to put it.
You still have to open the doors, check the transmission, and look under the hood.
The shiny paint job tells you absolutely nothing about the engine block. With dogs, you find the real, actionable information with your hands, not just your eyes.
So, getting hands-on.
Yes, it requires actual hands-on tactile mapping from the top of the head to the tip of the tail, and you don't have to make it a sterile clinical exam.
Right, that would be weird every night.
Exactly, you'd easily weave it into grooming time or a cuddle session on the couch.
Well, wait, I have to push back on this a little bit. Doesn't checking your dog for lumps, bumps, and tenderness every single day run the risk of turning you into a totally obsessive helicopter pet parent?
I hear that a lot.
Like, are we just supposed to live in a state of high anxiety, constantly searching our pets for a crisis?
That is a completely fair concern. But there is a massive physiological and psychological difference between obsessive monitoring and ordinary, relaxed familiarity.
Okay, how so?
Well, you aren't frantically palpating your dog for a tumor every time you pet them. You are simply keeping your hands educated on the specific geography of your dog's body.
Just knowing what's there.
Exactly. The overarching goal is recognizing a pattern shift. If you know exactly what the intercostal spaces between her ribs feel like every Tuesday, then when a subtle, doughy layer of fat starts covering them 3 months later, your hands will recognize the structural shift.
Way before you actually see it.
Long before your eyes ever register a change in her silhouette. You aren't searching for a crisis. You are mapping the territory so precisely that if a crisis ever arrives, you spot it at stage 1, not stage 4.
I love that framing, mapping the territory. So because that short coat betrays us, we have to look much closer at these specific anatomical vulnerabilities.
Working our way from the outside in.
Right. And skin issues are notorious in this breed.
Oh, dermatological issues can be incredibly frustrating for both the dog and the owner.
I can imagine.
The key differentiator you have to look for is the word persistent, because an occasional scratch is just life. Dogs get a random itch just like humans do.
Yeah, sure.
But you are actively mapping for persistent scratching, compulsive paw licking, generalized redness, greasy patches that leave a residue on your hand, or a distinct, almost Fritos-like yeast odor.
The Frito smell. And there is a crucial rule of thumb here that I think is just, well, human nature to get wrong.
The panic response.
Yes. When a skin flare-up happens, we panic. We immediately switch their food to a grain-free salmon diet. We buy a new, expensive medicated oatmeal shampoo. We add an omega-3 pump to their bowl, and we change the laundry detergent on their bedding.
All at the same time.
We do it all in the exact same week because we just want them to feel better.
Which completely destroys the scientific method of your care system.
Right, because how do you know what works?
Exactly. If you change 5 environmental variables at once, and the dog's skin miraculously clears up, you have absolutely no idea what actually cured it. Was it the salmon protein, or was it the new shampoo?
You're just guessing.
And conversely, if the skin gets significantly worse, you don't know which of those 5 new interventions triggered the allergic reaction. You have to be methodical.
So, one step at a time.
You must isolate and change one variable at a time, observe the results for a few weeks, and document it.
It requires a lot of patience when your dog is itchy, but it makes perfect sense.
Mm.
Let's move down the kinetic chain to the paws.
Okay, the foundation.
We assume that if a dog is suddenly reluctant to walk or is dragging her feet, she's just being stubborn or lazy. But often she just has a sore foot.
Right.
A cracked pad from winter salt, a micro burn from hot pavement, or a tiny thorn.
We constantly project complex human emotions onto our pets. Like, oh, she's just in a mood today.
Yeah, they're just being grumpy.
But an animal that historically loves walks doesn't suddenly adopt a philosophy of laziness. They are experiencing physical discomfort. And keeping a strict eye on nail length is a monumental part of this mechanical baseline.
Right, because long nails aren't just a cosmetic issue where they, click on the hardwood floor.
Not at all.
I was fascinated to learn about the orthopedic domino effect here. When a nail grows too long, it physically hits the ground and pushes the dog's toe up and back.
Exactly. Think about trying to hike in a pair of shoes that are 2 sizes too small, where your toes are constantly jammed upward.
Oh, that sounds awful.
It completely alters your center of gravity. For a dog, long nails force them to rock their weight backward onto the heel of the paw pad.
Which changes everything above it.
Yes. That alters the angle of the carpus, their wrist joint, which then strains the elbow, shifts the load bearing in the shoulder, and eventually causes chronic pain all the way up into the cervical spine.
It's a massive mechanical failure, starting right at the tip of the toes.
Precisely.
And speaking of human assumptions masking canine pain, let's look at the other end of the dog. Here's where it gets really interesting. The Bull Terrier has this iconic wedge-shaped head and an incredibly powerful jaw.
Very powerful.
And that muscular jaw totally fools people into thinking their actual teeth are invincible.
This is an incredibly dangerous illusion.
Really?
Yes. Jaw musculature has absolutely nothing to do with the thickness or durability of dental enamel. A bite force capable of crushing a thick branch does not grant the teeth magical protection against plaque, tartar, periodontal disease, or blunt force trauma.
So they're just as vulnerable.
In fact, giving them extremely hard, chews-like, weight-bearing marrow bones or dense nylon toys, because you mistakenly think their strong jaws need a challenge, is precisely how they end up fracturing their molars.
Oh, wow.
The jaw is strong enough to break the tooth against the toy.
But wait, if a dog fractures a molar, wouldn't they stop eating?
You would think so.
The veterinary data we're looking at explicitly notes that a dog will keep eating their kibble completely normally, despite severe, agonizing dental pain. If they keep eating normally, how in the world do you even know they are in pain?
Because a good appetite is a deep-seated neurological survival instinct, not proof of a comfortable mouth.
They just push through it.
In the wild, an animal that stops consuming calories quickly dies, so they will psychologically compartmentalize and power through excruciating exposed nerve dental pain simply to survive.
That is so sad, but amazing.
You cannot rely on an empty food bowl as a clean bill of health. You have to observe the actual mechanics of how they consume the food.
So you're looking for the subtle compensation behaviors.
Exactly.
Are they suddenly dropping kibble out of the side of their mouth? Are they tilting their head and chewing exclusively on the left side to avoid a cracked right molar?
Yes, or are they walking past that favorite hard rubber toy they used to carry everywhere?
Right. You have to observe the process, not just the outcome.
Precisely.
That is wild to think about. They are literally masking their agony to survive life in our modern living rooms.
That's a survival trait.
Now, because they mask that pain so well, they'll keep eating. And that continuous appetite, combined with the altered biomechanics from sore paws or spinal strain we just talked about, sets the stage for the next massive structural threat.
Hidden weight.
Yes, hidden weight.
Creeping weight gain is arguably the most pervasive, silent epidemic in modern veterinary medicine.
And especially with this breed.
Right. With a robust breed like the Bull Terrier, their natural breed standard physique actually works against them. They are genetically designed to look solid, broad, and heavily muscled.
So they already look a bit chunky by nature.
That visual standard constantly normalizes excess subcutaneous fat. Owners look at their dog and think, oh, she's not overweight, she's just big-boned and broad.
But that's not true.
No. The anatomical wastes that tuck behind the ribs should never disappear just because the dog has a powerful skeletal build.
Muscle and fat are entirely different biological tissues, and, the scale at the vet's office doesn't differentiate between them.
Exactly. Pound is a pound on the scale.
A dog can be severely undermuscled but overweight, or they can be highly muscular and overweight. The number on the scale is just total mass. You have to actually feel the ribs.
Yes.
It should feel like running your fingers over the back of your hand, not like poking through a thick foam mattress.
Because that excess adipose tissue isn't just cosmetic, inert padding. Fat is biologically active.
It actually does damage.
It acts as a massive burden on the skeletal system, exponentially increasing the risk of cruciate ligament tears and early onset arthritis. It severely cuts into their heat tolerance because the fat acts as a literal layer of thermal insulation.
Which is incredibly dangerous during summer months.
Very dangerous. And metabolically, it forces the heart to work overtime just to pump blood through miles of extravascular tissue.
Which brings us directly to how they move. We're supposed to watch for intermittent skipping or stiffness.
Yeah.
And what I found absolutely brilliant in our materials today is the advice on how to handle that skipping.
The video trick.
Yes. If you see your dog holding a back leg up briefly, you take a safe phone video of it immediately for the vet. Because I swear, every pet I've ever owned miraculously stops limping the exact millisecond we walk through the clinic doors.
Oh, it's a well-documented phenomenon. It is the adrenaline spike of the veterinary clinic environment.
They just get too excited.
The dog gets nervous or overly excited by the smells. Their cortisol and adrenaline levels surge, and it temporarily masks the pain receptors. They will walk perfectly in the exam room.
Making you look crazy to the vet.
Exactly. A video gives the veterinarian undeniable objective proof of what is happening in the dog's relaxed baseline home environment. And it's crucial to remember that a skip isn't always a blown knee.
Right, the kinetic chain.
Because of that kinetic chain we discussed, it could be a referred pain from a sore paw, a compressed spinal disc, or early hip dysplasia.
What's fascinating here is, wait, I think I'm stealing your line.
I'll let you borrow the line.
Thanks. But seriously, looking at how all this connects, exercise isn't just about burning off crazy dog energy so they don't eat your couch while you're at work.
No, exactly right. What's fascinating here is that purposeful exercise is actually a fundamental structural pillar of prevention.
It's preventive care.
Yes. Consistent movement supports lean muscle mass, and that muscle acts as a biological shock absorber for the joints, taking the load off the cartilage.
That makes total sense.
It supports cardiovascular fitness, provides vital mental engagement, and promotes deep restorative sleep. You aren't just tiring the dog out, you are actively conditioning their musculoskeletal system to withstand the inevitable wear and tear of aging.
So we've heavily covered the visible mechanics, the joints, the weight, the teeth, the movement, but all of this directly impacts the invisible internal systems.
The engine under the hood.
Let's talk about the silent signs of the heart, the kidneys, and hearing.
These are the critical areas where your daily baseline observations are literally life-saving. For the cardiovascular system, you aren't listening with a stethoscope.
No, you can't do that at home.
You are watching for persistent dry coughing, which happens when an enlarged heart physically presses against the trachea, or you are watching for fainting spells, or a noticeably slower recovery respiratory rate after a short game of fetch.
But context is everything here.
Always.
Like a dog panting heavily and acting lethargic on a humid 90-degree afternoon isn't automatically in congestive heart failure. Excess weight, poor cardiovascular conditioning, and basic heat exhaustion look functionally identical to early cardiac issues.
Exactly. The baseline tells you if the slow recovery is new or just a result of the summer heat.
Right.
And then there are the kidneys. The external behavioral signs of internal renal failure are significantly increased thirst, a massive uptick in urination volume, or sudden house soiling from a dog that has been perfectly potty trained for years.
And there's a massive flashing red light rule here. Never, ever restrict a dog's access to water just because you're tired of taking them out to pee, unless a vet explicitly tells you to.
Never.
No.
I like to use the analogy of a torn coffee filter.
Oh, that's a good one.
If the nephrons in the kidneys, the filters are damaged, they let all the bitter, toxic grounds slip through into the bloodstream. If a dog is drinking excessively, it is because their body is desperately trying to dilute and flush those toxins that the torn filters are failing to process.
So taking water away makes it worse.
Taking their water bowl away just accelerates the toxic buildup and the organ failure. And unfortunately, home observation usually cannot catch early-stage kidney disease
Because they hide it so well.
because kidneys are incredibly resilient. By the time a dog is visibly drinking excessively, nearly 70% of their kidney function is already permanently gone.
Wow, 70%.
That is exactly why routine veterinary lab work, annual blood and urine panels is absolutely non-negotiable. Labs catch the microscopic cellular changes that your eyes cannot.
That coffee filter analogy makes so much sense. The water is just them trying to dilute a terrible cup of coffee inside their bloodstream. Now, regarding hearing, I was surprised to learn that a dog who is completely deaf in one ear can seem perfectly normal. How do they compensate so well?
Dogs have highly mobile pinnae, the external ear flaps.
Oh, right, they move all around.
They act like directional satellite dishes.
Yeah.
If one ear fails, they simply learn to pivot their head and use the remaining ear to sweep their environment and triangulate sound.
That's incredible.
They adapt so seamlessly that owners rarely notice. You have to actively watch for them startling more easily when approached from a blind side, or acting confused about the spatial origin of a sound, like a squeaky toy behind them.
Okay, I have a question about overall risk, because we're talking about all this intense screening.
Sure.
If I have a strictly indoor dog or an urban dog that just walks on paved city sidewalks and never goes into the deep woods, do we really need to worry about intense year-round parasite prevention or these deep internal screenings?
It's an incredibly common assumption, but yes, you absolutely do.
Really? Even in the city?
Fleas, ticks, and internal parasites thrive in urban environments. They catch rides on city rodents, stray cats, other dogs at the local park, or even hitch a ride into your apartment on your own shoes and clothing.
Oh, right, on our shoes.
An indoor urban lifestyle is not a magical force field. However, the exact protocol for vaccines and parasite prevention shouldn't just be a generic one-size-fits-all printout.
It has to be customized.
It must be highly individualized with your veterinarian, heavily based on your specific local geographic risks, whether your dog frequents urban daycares, and your personal travel habits.
So we know how to map the territory externally, and we understand the mechanics of the internal engine. How do we effectively translate all of these daily home observations into actionable professional care?
That's the crucial next step.
Because let's be honest, going to the vet can be highly stressful and the clock is ticking the second you enter that exam room.
It starts by fundamentally understanding that in dogs, behavior is very often a direct medical symptom. Sudden irritability, a new lack of tolerance for being handled or groomed, or dramatic shifts in their sleep cycles are almost always pointing to underlying physical pain, not a sudden behavioral regression or a training failure.
And to even safely spot that pain, you need a dog that actually allows you to examine them.
Exactly.
This highlights the absolute necessity of cooperative handling. If you've trained your dog to be comfortable voluntarily presenting a paw, standing still for a tactile exam, and letting you gently look inside their mouth, Home checks and vet visits become vastly more efficient.
It makes a world of difference.
You aren't wasting 15 minutes of a vet appointment wrestling a terrified alligator just to look at a cracked nail.
Exactly. You want the vet's time spent on diagnostics, not restraint. And when you do step into that clinic, you need to bring a specific chronological timeline.
Don't just say they feel bad.
Right. Don't just walk in and offer a vague, well, she's been acting kind of off lately. That gives the diagnostician very little to work with. Note exactly when the symptoms occur.
Like time of day.
Is she coughing only when she's completely at rest, only immediately after eating, only in the middle of the night? That specific context narrows down the diagnostic tree instantly.
It's also highly recommended to keep a running, updated list of all medications, over-the-counter supplements, and topical treatments you use.
Crucial.
It prevents accidental double dosing and helps the vet spot dangerous chemical interactions. I know digital health lockers like VitalPet are great for keeping all this organized directly on your phone so you never forget a medication name under pressure.
Those apps are lifesavers.
So what does this all mean? It means understanding your specific dog's baseline, but also their breed hazards. Bull Terriers, for instance, notoriously investigate the world with their mouths.
They certainly do.
Therefore, actively securing toxic human foods, TV remotes with batteries, and ibuprofen on the nightstand isn't just about keeping a tidy house. It is a direct, breed-specific, preventative health intervention.
This raises an important question about how we view the entire aging process of our pets.
Oh, definitely.
Senior life in a stoic, robust breed rarely announces itself with one dramatic, movie-style moment of collapse. It doesn't happen overnight.
It's subtle.
It manifests in gradual, almost imperceptible shifts. It's a slight change in how deeply they sleep, a micro-hesitation before they jump into the car, or a shift in how they shift their weight when sitting.
And the only way you can possibly recognize those subtle senior shifts is if you spent their entire adult life learning exactly what their prime baseline felt and looked like.
Exactly.
Good preventive care is inherently quiet. It is incredibly ordinary. It's wiping the paws after a rainy walk, finding the tiny red spot, knowing the exact geography of their ribs, and looking far past that tough dog exterior to truly understand the mechanics of what's going on under the hood.
It's taking the time to build a specific, actionable, and objective timeline for your veterinarian rather than relying on vague feelings and panic, last-minute kitchen sink interventions.
And look, you do not need to own a Bull Terrier for this exact framework to completely change your life and your pet's life.
No, not at all.
The discipline of observing a daily baseline, the patience of resisting the urge to change 5 environmental variables at once when your pet gets an itch, the foresight of preparing for toxic emergencies before they happen. That logical framework applies to any pet, any breed, anywhere.
It really does, and it leaves you with a profound thought.
What's that?
If we have to systematically build this intricate, tactile baseline for our pets because they cannot speak, because we now know they possess the biological drive to literally keep eating with a fractured tooth just to survive.
Right.
What silent structural shifts in our own human bodies are we completely missing?
Oh, wow.
What gradual changes in our own chronic stress levels, our own degrading sleep quality, or our own toxic daily habits are we entirely ignoring simply because we've gotten a little too good at looking perfectly fine on the outside?
Wow, that is definitely something to chew on. Just like that dog trotting off into the living room with a toy, sometimes looking perfectly healthy is the most dangerous disguise of all. Thank you for joining us for this deep dive. Make sure to check the materials linked in the description, and as always, consult your own vet for personalized medical advice. Until next time.